So we were just talking with Senator Rand Paul a little bit about what's happening in states and cities like New York City with COVID-19 and the increased transmissibility of the COVID-19 Delta variant. The most interesting statistic as I look at vaccination rates around the country may actually be what's happening in hospitals in Ohio and in many other states, because the people who work in these healthcare facilities are people who should know the risks of COVID-19. And if anyone would have easier access to the vaccine, it would be people, working right there in a doctor's office, in a hospital, in a facility with medical professionals. However, as we look at federal data from around the country, many state hospital systems have the highest rate of unvaccinated employees everywhere. I'm looking at California, at Georgia, at New Jersey, at North Carolina, and more. Dr. Fahmi Farah is a medical expert, a cardiologist based in Texas. Dr. Farah, what are you seeing in your state?
The statistics are pretty much the same, similar across the nation. I am here in Dallas, Texas. We're having similar issues as well. A lot of healthcare professionals not willing to take the vaccine. So that part is quite disappointing.
So do you know something about the vaccine that we don't? I mean, what's the hesitancy?
The census I'm getting is the people who are choosing not to get it, they're concerned that it has not been out long enough, and they're concerned for the long-term implications that they could have possibly down the road, which, clearly that should not be a concern, especially from healthcare professionals, because we know we've had millions of people vaccinated already. The vaccine has been out. All of the vaccines have been out for quite some time, and we have a lot of data at this point, and the data looks good. I don't think that should be a concern at all from healthcare professionals. I think the number of people taking the vaccine should be far higher.
Well, when you say clearly, I mean clearly it's not, because these are people who have studied vaccines and have studied virus and illnesses and disease and have access to many other vaccinations that have been effective and around for dozens of years. This one, of course, has been around for a few months. I think the concern may be, and this is what I'm hearing from a lot of people who are remaining unvaccinated at this point, is that we've got data on what it's doing right now, but we don't know what it's going to do 10 years, 20 years from now, especially in younger people who are receiving it, even though the science is there. And this is not a DNA-altering vaccine. The science is there. It's not mutating our DNA. It's using the components of the mRNA technology to attack the COVID-19 virus. And the more people who are vaccinated, the fewer people who get the virus and spread the virus, the fewer mutations there might be, and we could finally get out of this.
You're absolutely correct, and I completely agree with that. Although the vaccine has not been out for that long, the science is there, and we've had vaccines in the past. The concept of vaccine itself is not new at all. As you said, we've had it for decades, many other types of vaccines, and they help eradicate different types of viruses and illnesses and save millions of lives worldwide. And, at this moment, in the midst of this pandemic, we've already dealt with it for over a year. And the real hope of coming out of this pandemic is the vaccine. We have a real chance here. And the more people that vaccinate, the less opportunity the virus will have to infect more people. And by infecting more people is how a virus thrives. And the more people it infects, the more mutations it generates and the more different types of variants there will be, and it'll just sustain itself. And the only way to get out of it is truly the vaccine.
So as all of these healthcare workers are spending time in the hospital and medical facilities where they work, and they see that a majority of people coming into the hospital for COVID-19 related illnesses or the disease itself are unvaccinated. I mean, even President Biden has admitted it's a pandemic of the unvaccinated. Why the resistance still? I think that's concerning to people who have been on the fence about getting the vaccine. If their doctor, if their nurse practitioner, if their medical provider doesn't want to get the vaccine, why should they?
Right. as medical professionals, you're right. Being, myself in the front line, we have seen the devastation this virus is capable of causing, especially during the peak during December, January here in the U.S. It was terrible. The number of lives we saw being lost, the amount of suffering it caused, not just for the patients, but the family members as well. And many of these healthcare professionals, they were there. They saw the devastation it's capable of causing. And so, my encouragement would be for both all healthcare professionals as well as non-healthcare professionals who are eligible to take the vaccine, to take the vaccine. We know it's safe. We've had much data available already. Millions of people have been inoculated, and they've all done very well with a very small fraction of side effects and reactions, which is expected with any vaccine. Even if you take the flu vaccine, for example, every year, we get people who get reaction to the flu vaccine as well. But the statistic, the vast majority of the people do well, and that's the reason why vaccines exist. And in my opinion, the COVID-19 vaccine is no different.
Dr. Farah, do you think we may have sold the vaccine incorrectly when it first came out as part of Operation Warp Speed? I think that there was the misconception that if you got vaccinated, the likelihood of you getting the virus was very small. And instead of presenting it that way, especially when you look at the number of breakthrough cases we're seeing now, I personally know at least 10 people I can think of off the top of my head who have had a breakthrough case after being fully vaccinated for a while. Should we have sold this more of, look, you might still get it, but it reduces the chance that you would get it. If you do get it, you're not going to be as sick, and the chance of dying or having to go to the hospital is remarkably lower. That's setting perhaps more realistic expectations for what this vaccine actually does.
You're right, it does. And both of those statements are correct. People who get fully vaccinated, they are less likely to get the virus. Their chance of getting it is far reduced. Additionally, for those breakthrough cases, for those who do end up getting the virus despite getting fully vaccinated, you're absolutely right. Their chance of getting really sick and ending up in the hospital or in the ICU or it becoming a fatal case is very, very less compared to those who are unvaccinated. And so the message should be to actually promote both, that yes, they're both facts. If you get the vaccine, you're less likely to get the virus and less likely to get sick if you actually get a breakthrough infection.
So, Dr. Farah, you, as a medical professional, you were probably, I guess, in phase 1 in Texas in the first group of people to get the vaccine, probably in December or January. Are you concerned, or did you get?
Yes. You're right. I was one of the first people in the state of Texas to get the vaccine. I got it actually on the very first day it became available, which was in December. And, I was happy to get the vaccine. I believed in the science, and the concept of vaccine itself is not new at all. And so that's where my comfort was. And seeing in the front line what the virus itself is capable of doing, it's a no-brainer that we need to take the vaccine. And I'll tell you one other thing. The concern that people have, those who are choosing not to vaccinate, with the concern of what it may be capable of doing in the long term. Let's look at the virus itself, the infection, what it's capable of doing long term. We have many, many patients who had the infection more than a year ago now, and they're still suffering. They have not been able to get back to their normal routine of things. They have many, many comorbidities as a result of the long-term effects of what the virus is doing. So to say that we're fearful of the vaccine, of what it's capable of doing long term, that's based on skepticism. However, we have data and proof as to what the virus itself is capable of doing long term at this moment.
As a cardiologist, it seems like one of the big concerns has to do with heart disease after contracting COVID-19. We're seeing this in a lot of athletes, and that's one of the reasons why a lot of study time is being spent on professional athletes who have had COVID-19, because they're generally considered to be in peak physical shape, and some of the more healthy people who have contracted the virus.
That's correct. We're seeing long-term effects in a lot of people who are young, like you said, who are very healthy, otherwise like athletes, as well as young people in their 20s who are getting cardiac problems like arrhythmia, atrial fibrillation, heart failure. All those are very serious conditions, and those are chronic conditions that these guys are now having to deal with as a result of the virus itself, not the vaccine, the virus. So that's why, the encouragement is to really take the vaccine for those who can and are eligible to. It really can save lives.
Do you think we'll need a booster shot here this year?
I am, curious to see what the data shows. As of right now, it seems like it's a very realistic possibility that we will be needing a booster shot, but I'd like to get more data on that.
Yeah, it's also going to be interesting if opinions change, especially among healthcare professionals once this emergency use authorization expires and they receive full FDA clearance on it.
Yes.
That may change many attitudes. At least I hope it would. We'll see what happens there. And you don't have to answer this question. I know it's kind of a hot button issue. Are masks helping in some of these areas where the Delta variant is spreading faster than others?
I do think that masks are helping, and we know throughout the pandemic that masks have helped. At the beginning of the pandemic, where we either did not have masks available or they were not enforced as well, the virus was spreading very rapidly. And then once we realized that masks do help, and we became very diligent about mandating masks and wearing masks, we saw a steady decline. So there's no question that masks help. And in areas where the numbers are very high right now, it is a good idea for them to be diligent about wearing masks and maintaining social distance.
Dr. Fahmi Farah, cardiologist, medical expert from Dallas, Texas. Thank you so much for your time. Great insight.
Thank you for having me.